Good afternoon. My name is Giselle de la Rosa, and today I would be talking about the EKG procedure, a brief, short explanation of what is the history of it. I will start off with when it was invented. This EKG medical necessity was invented around the years of 1860 and 1927. It was invented by William Einthoven and won the Nobel Prize in 1994 in medicine. This gave a lot of opportunities to record cardiac rhythms, because back before those years, before the EKG was invented, many patients, thousands, not many, but thousands of patients would die of coronary artery disease, and doctors weren't unable to determine what was going on in their cardiac activity. So this machine, the EKG that William Einthoven invented, has helped a lot of patients get the proper care of the rhythm or about the procedures when they see that something's not right. Improvements do take along the year. Every year there's improvements of the EKG machine, and it gets better and better. However, it is important to make sure that this procedure is done properly and completely, because it does determine the patient's care. So it's very important to know where to place the leads and the proper way to complete an EKG procedure. The purpose of the EKG is to determine the cardiac rhythm, and most patients that get this performed are the ones that present to the office, or they call about chest pain, shortness of breath, dizziness, and syncope. This would help. The EKG does help determine, what's going on with their heart, and give a proper care for the patient at the end of the consult. Today, I would be usually using my mom as a patient, and I would pause this briefly just so I can bring the patient in. Okay, as I go into the room, I will go ahead and introduce myself to the patient. As I'm entering the room, buenas tardes, good afternoon. My name is Giselle, and I will be helping you with the procedure of EKG. This procedure is non-invasive procedure, and it helps determine the cardiac rhythm in your body to determine further review. Can you please go ahead and verify your date of birth and name? Can you go ahead and please verify your name and date of birth? Su nombre y fecha de nacimiento?
Norma de la Rosa, 3/368.
Okay, thank you. I would have a tray next to me just to have the right things I need. I have the the sterile alcohol prep pad. I would wipe this with this to the skin first. And the patient's already in a supine position. I would explain to them that it's a non-invasive procedure. Puede relajar sus piernas. And I would expect them to explain them that they have to be relaxed. Nomás relaje su cuerpo, ponga sus brazos al lado. Okay, so the patient's already in a supine position. I will go ahead and prep the skin. And I will use cotton balls to go ahead and put them to the skin. So the first one, I would go ahead and prep the skin, wipe in the hacer más para acá, así, pero relaja así como tus brazos para allá. Okay. I will go ahead and wipe the skin, of course with the shirt on, off, but no, deja así. And let it dry. So the first one that I would apply would be in the, this would be the V1. It would be in the fourth intercostal space, right sternal corner. Okay, I will place it right here. The second one will be in the fourth intercostal space, left sternal corner. Let me get the... Okay, I'm sorry about that. I had to get the cotton balls. The third one would be halfway between the V2 and the V4 lead. The fourth one would be in the fifth in intercostal space in the left mid-clavicular line. The V5 would be in the anterior axillary line, same horizontal as level 4. We'll place it right here. I'm trying not to fall, but it would be in the anterior axillary line, same level as a horizontal level 4. And the last one would be the V6 line. It's a little bit hard to put it there, but it is in the mixed axillary line, horizontal level, the same level as V4. I wouldn't. If you can please relax. This would take about a minute or two. We would suppose the minute passes and the results are printing, and I will go ahead and remove everything. So we'll go ahead and remove these with careful attention.
¿Cómo salieron los resultados?
Okay. Eso se lo puede explicar el doctor en más detalle. Yo no sería la persona correcta en decirle cuál es la razón, cómo salieron los resultados.
Okay, gracias.
Okay. And I would go ahead and help the patient. Okay, so then I would go ahead and help the patient and make sure to take off my gloves and ask them if they have any further questions. ¿Tiene alguna otra pregunta? Any other questions that I could be able to answer?
No, es todo.
I would then thank the patient and let her know that the doctor will review the results with her. Thank you.
Gracias.